Welcome back, everyone. Rasim here, and today we're opening the door to a place that almost everyone visits, but very few people truly understand: the general dentist's chair. You know the feeling. You sit down, the light swings over your face, instruments start clinking, and suddenly you're wondering, what exactly is happening right now? Is the dentist just checking your teeth? Or is there a whole hidden system of decisions going on behind the scenes? Well, today I'm joined by someone who knows every secret of that chair. Dr. Esma, doctor, be honest with us. Are dental visits really as simple as open wide and rinse, or is there a lot more going on that patients never notice?
Rasim, that is exactly the right question to ask. Most patients think a general dentist is just looking for cavities, but the truth is much deeper. During a routine visit, a dentist is quietly evaluating dozens of things at the same time: the health of your gums, the alignment of your bite, tiny enamel cracks, early signs of infection, even how your jaw moves when you talk or chew. Many of these clues appear long before a patient ever feels pain. So while someone might think nothing important is happening, a general dentist is actually performing a full diagnostic puzzle in real time.
Wait, so while I'm sitting there thinking about lunch, the dentist is basically running a full investigation inside my mouth? That sounds a little intense. Now I'm curious, Dr. Esma, are there things a general dentist can detect before patients even realize something is wrong? Like warning signs hiding in plain sight?
Absolutely, Rasim. One of the most common situations is when a patient feels completely fine and assumes everything is healthy. But a general dentist often notices subtle warning signs long before discomfort begins. For example, slight gum inflammation might hint at early gum disease. Tiny enamel lines can suggest grinding during sleep, and small dark grooves on molars may signal the beginning of decay. Patients rarely notice these details because they develop gradually. During a routine exam, a general dentist connects these small clues like pieces of a puzzle. That is why dental visits are not only about fixing problems, they are also about catching changes early, sometimes months or even years before they become serious.
That explains something I always wondered about. Sometimes a dentist looks at an x-ray for a few seconds and suddenly says, "We should keep an eye on this tooth." Meanwhile, the patient is thinking, "But it doesn't hurt at all." So the real mystery is this: how can dentists see trouble before we feel anything? It almost sounds like dental intuition.
It can seem like intuition, Mr. Rasim, but it is actually careful observation and experience. A general dentist studies patterns every day: the shape of a cavity starting, the color change in enamel, the spacing between teeth that reveals pressure from grinding. These signs are quiet, but very clear once you know what to look for. That is why regular visits are powerful. They allow a dentist to compare what your mouth looked like before with what is changing now.
Okay, Dr. Esma, this makes dental visits sound a lot more important than people realize. I think many of us wait until something actually hurts before booking an appointment. But from what you're saying, pain is basically the last alarm bell. By the time someone feels it, the dentist has probably been able to see the warning signs for months. So let's say someone skips regular checkups, what kinds of problems could quietly grow in the background? Are we talking about small issues turning into bigger treatments, or even problems that affect overall health?
That is exactly why regular visits matter, Rasim. A tiny cavity that takes 10 minutes to treat can slowly grow into a deep infection if ignored. I often see patients who felt nothing at first, but months later the same tooth suddenly needs a much more complex procedure. The same happens with gum disease. Early redness can be reversed easily, yet advanced gum damage can threaten the stability of teeth. A general dentist's job is to interrupt that chain early. When we catch small changes quickly, treatment stays simple, comfortable, and predictable.
So the real secret is that the general dentist is protecting patients from problems they cannot even see yet. That makes the routine visit feel less like a quick check and more like preventive strategy. Dr. Esma, I think many people imagine dental visits as routine, almost mechanical. You walk in, someone checks your teeth, maybe a quick polish, and you're out the door. But listening to you, it sounds more like a detective story happening inside the mouth. And here's something interesting I once heard: a huge percentage of dental problems are discovered during routine exams, not when patients come in with pain. That means the dentist is often spotting the issue long before the patient even suspects something is wrong. So I'm curious, do you have a real example where a simple checkup uncovered something that could have turned into a much bigger problem later?
Actually, yes, Rasim, and it happens more often than people expect. I once had a patient who came in for what he thought was just a routine cleaning. He felt perfectly fine, no pain at all, but when we examined his molars and looked at the x-ray, there was a very small shadow beneath an old filling. That tiny sign told us decay had started underneath the surface. If it had gone unnoticed for another year, it might have reached the nerve of the tooth. Because we caught it early, the treatment stayed simple and quick. That is the real power of a general dentist visit, identifying problems while they are still small enough to solve easily.
Dr. Esma, something you said earlier caught my attention. You mentioned that dentists can read tiny clues inside the mouth, almost like a science experiment happening in real time. That sounds fascinating, because most people probably think dentistry is just about drills and fillings. But it seems like there is actually a lot of biology and research behind those decisions. So when you look at a tooth, what exactly are you analyzing? Are you thinking about bacteria, enamel strength, gum response, maybe even how someone brushes at home? I imagine there's a whole scientific process behind what looks like a simple exam.
You are absolutely right, Rasim. Dentistry is deeply connected to biology and microbiology. Inside every mouth, there are hundreds of types of bacteria forming communities we call dental biofilm. A general dentist studies how those bacteria interact with enamel, saliva, and gum tissue. For example, when we see early mineral loss on enamel, we know acid produced by bacteria has started affecting the surface. When gums bleed slightly, it can signal inflammation triggered by bacterial buildup. Even the shape of wear on a tooth can reveal grinding habits or bite imbalance. So during a dental visit, we are constantly interpreting biological signals. The goal is not only to repair damage, but to understand why it started and how to stop it from returning.
Alright, Dr. Esma, now I want to walk through the actual moment people experience. Imagine someone sitting in the dental chair right now. The bright light is on, the chair leans back, and suddenly, a few different tools appear. For many patients, this part feels mysterious, maybe even a little intimidating. So let's break it down, step by step. What exactly is happening from the moment the dentist begins the exam? If we slow the process down, what are the stages a general dentist follows to understand the health of a patient's mouth?
Great question, Rasim. The process is actually very structured. First, a general dentist visually examines the teeth and gums, looking for color changes, swelling, or plaque buildup. Next, we use a small mirror and explorer to gently check each tooth surface for softness or irregular texture. After that, the gums are evaluated carefully to see how healthy the tissue is around every tooth. X-rays may also be reviewed to look beneath the surface where the eye cannot see. Finally, we combine all of that information to understand the complete picture. It is not one single check, it is a sequence of observations that together reveal the patient's oral health.
Dr. Esma, I think a lot of viewers are realizing something right now. A dental visit is not just about fixing teeth, it is also about habits people bring with them. Some patients probably make things easier for their dentist, while others accidentally make the exam harder. So let's talk honestly for a moment. Are there common mistakes people make before a dental visit? Things they should definitely do, and maybe things they should avoid, so the dentist can get the clearest picture of what is happening inside the mouth.
That is a great point, Rasim. One helpful thing patients can do is maintain their normal brushing routine before a visit. Clean teeth make it easier for a general dentist to see natural tooth surfaces and gum health clearly. But there are also a few things people should avoid. For example, trying aggressive last-minute brushing or using unfamiliar whitening products right before the appointment can irritate the gums and temporarily change how tissues look. The best approach is consistency. Regular brushing, flossing, and honest communication with the dentist help us understand the real condition of the mouth. That information allows a general dentist to give the most accurate advice.